All right, good evening, everyone. My name is Les Smith. I'm with the Michigan Department of Environment, Great Lakes and Energy. It again is my pleasure to welcome you to this evening's conversation concerning the Otsego Area Environmental Investigation Update. Joining me is Sue Manente from the Michigan Department of Health and Human Services. And also mention that I have a colleague working behind the scenes. Mr. Matt Tomlinson is actually my co-host as well. Before we get into this evening's conversations, I would like to toss the virtual microphone to Sue with some opening remarks.
Thank you, Les. Hello, everyone. As Les said, my name is Sue. I'm with the Michigan Department of Health and Human Services, and we would like to thank you for joining this meeting tonight. We understand these are really difficult days, and we appreciate your time and participation during this meeting this evening. Tonight, we're going to provide you with some information on the Otsego area PFAS investigation, and we're going to be hearing from the Allegan County Health Department. We'll be hearing from the Michigan Department of Environment, Great Lakes and Energy, from the Michigan Department of Health and Human Services, and then we'll have a question and answer session where we'll take questions from you and do our best to answer those questions that you have. And then we'll conclude the meeting around 8 o'clock. First, Les is going to give us some information on how to use Zoom.
Thanks, Sue. Just wanted to let you all know, for many of you, this might be new to you with our webinar format. In this Zoom meeting webinar, all of your lines are muted. So hopefully you can hear us, but we won't be able to hear you. But I'm going to tell you in the next slide here how you'll be able to communicate with our panelists this evening. Also want you to be aware that this evening's conversation is being recorded for later viewing. And later in the webinar, I will share with you approximately when that will be available and where to locate this recording at a later date. As we transition to the next slide, I want you to be aware that in the Zoom question and answer panel at the bottom of the screen, you'll see a Q&A box. At any time during the webinar, this evening's conversation, please feel free to type your questions in. If you hear something that you have a question about, feel free to type it in. We will be addressing those questions during the Q&A portion of tonight's conversation. There's an opportunity for you also to raise your hand electronically in the Zoom control panel. Feel free to raise your hand during the Q&A portion of this evening's conversation. And lastly, we have 4 individuals that are listening by phone only, and welcome to the webinar. You also have an opportunity to raise your hand electronically for the four callers that we have on right now. When we get to this evening's Q&A portion, if you have a question for this evening's panelists, you can push the star key and the number 9. Again, that's the star and the number 9 key to electronically raise your hand for those on the phone. And don't worry if you didn't get all that. When we get to the Q&A portion later on, I will briefly go over this housekeeping information again. And with that, Sue, I'll hand it back to you.
Great. And we know that some of you are on the phone, or you may have difficulty seeing some of the slides on an iPad or your phone. So we'll do our best to describe what is on the slide that's being presented at the moment. And these slides will be available on the Otsego webpage, which I'll show you when we get to the end of the presentations. So now I'd like to introduce Angelique Joins, who is the health officer for the Allegan County Health Department. Angelique.
Hi, good evening. I appreciate you all taking the time this evening to join us. I know that we've been on this journey for a couple of years now, so I kind of just want to walk through the timeline of events in case we have people that might be newer to the journey in this investigation. So I kind of just want to walk us through some of the high level steps or items, and then we'll end where we are currently and move on to Eagle's presentation where they can talk about all the work that they've been doing in the last year. So I know that I can remember the day that it was actually the day after my daughter's birthday. So it was March 5th of 2018. I was contacted by MDHHS in regards to community concerns in the Otsego area. And there was a resident, Mary Clark, who had contacted ASDTR, so the Agency for Toxic Disease Registry. And they and in turn had contact with MDHHS, the Michigan Department of Health and Human Services, with some concerns. They had collected a few hundred surveys and had some concerns around potential health issues from the information received from the Facebook surveys. So on March 10th, we decided to have a town hall meeting. So the agencies that are here today were a part of that meeting. And April of 2018, we did a follow-up meeting with the community. So we promised to bring back some information at that follow-up meeting. So in April, we committed, Eagle committed to doing some sampling of private wells in the area. MDHHS at that meeting committed to conducting a comparison of the cancer prevalence rates in the Otsego area by zip code with the cancer prevalence rates in Allegan County, the state of Michigan, and the United States. And so that brought us into July of 2018. Eagle completed sampling of 56 private wells in the Otsego area and submitted them to a laboratory for analysis. So then we moved into August of 2018, and we held an open house. There were a lot of questions in the community. We were waiting on lab results for those samples. And so we had an open house where the agencies who were on this call were a part of, to be able to allow the residents to have an opportunity to speak with experts and answer questions that they might have. In September, we got some of our lab results back. So initially we had some preliminary lab results that indicated that potentially there might be dioxin in 16 wells. So we those labs were sent. They at that time there had only been a few dioxins. It was really a screening that had been done. So those labs, the screening, that was sent back to the lab to do a full panel or screening of labs and, a full screening of the dioxin and the furan compounds. So at that time, we got lab results back towards the end of September, which showed that there was a issue with quality assurance. So the labs came back and there was not dioxin in those wells that we had previously screened. So in October, again, we talked about the lab analysis of the private wells and we had a community meeting. So back in October of 2018, we had a community meeting and shared the results of the findings at that time. And that's also included on our webpage, which I don't think is included, but we do have all the presentations at Allegan County. So it's www.allegancounty.org/health. If you go to that webpage, there's a groundwater investigation page. You click on that and go to Otsego and you'll be able to see the presentations from these prior community meetings. There's a lot of information in that. So then that brings us to March of 2019, and Eagle, which at that time was DEQ, Department of Environmental Quality, did a press release regarding the soil testing. That brings us into June of 2019, and Eagle provided an update out on soil sampling results. In August of 2019, our agencies met to review the preliminary soil results, and an update was sent out to our Otsego listserv, which has over 500 individuals on, and also sent out to, and also shared out on social media. That brings us to September of 2019. Again, another meeting with the agencies to look at our soil sample results. Brings us to October of 2019, where we looked at the water sample results that were collected. Brings us to December of 2019, where from the water sample results on the soil samples, we worked with the Hazelwood community to ensure that residents were given filters and at that time. So then discussion at that time started with the township. So with Otsego Township on municipal water supply for that community. So that brings us into the spring, summer of 2020. So Eagle will talk about some of the work that they've done, but they did additional groundwater sampling as well as some other investigative work, which they'll cover in the next presentation. Now we're at May of 2020. Otsego area was added to the MPART website as an area of interest. And then that brings us to November of 2020. And Eagle did a press release talking about some of the work that was accomplished over the previous year. So again, as you can see, we've been on this journey for about 2.5 years, and there's been a lot of work done, as we know, with environmental investigations, that it takes time. We understand that this time is hard for everybody for different reasons. And we appreciate you again joining us and continuing on to learn more about what's going on in your community. Thank you for your time, and I will move on to our next presenter.
Thanks, Angelique. Our next presenter is Chris Lantinga with the Michigan Department of Environment, Great Lakes and Energy.
Great, thank you for the introduction. Thank you for that as well, Angelique. Again, I'm Chris Lantinga from Eagle. I presented a couple times before, and tonight I'd like to kind of get you up to date on what we've been doing over the past year. And I think that summary helped out from Angelique, so I'm not going to go through every detail. So let's see here. You advance that slide for me.
Yeah, Chris, I can do that. Or do you want to share your screen? I'm fine.
Oh, yeah,
I'm fine advancing slides for you, though.
Okay, hold on a second.
Chris, I should probably advance from here.
Yeah, okay. I'll just have you advance and that'd be good. That'd be good. Okay, meeting topics. So tonight what we want to talk about is the recent investigations, the summary, kind of a quick summary of what we've done and where we're going. We want to look at the Hazelwood 2nd Street, as well as Hazelwood Drive and 2nd Street in Kalamazoo County, the residential well sampling that we've done there. And then we've also done a kind of a focused soil and groundwater investigation summary in the field that is nearby Hazelwood, as well as a couple other locations between the fields as well as at Hazelwood there, to understand the soil and the groundwater. In addition, I'm going to kind of present a brief summary of the work that's been done at the Menasha landfill to further investigate both the soil, the groundwater, as well as actually the surface water by the Menasha and their consultants. And then lastly, we've also done additional residential well sampling in the last couple months here, and I'd like to give an update on that as well. Next slide. Okay, just before we get into that, I just wanted to mention the cleanup criteria. So as you recall, we talked about the 70 parts per trillion combined PFOA and PFOS criteria, and that was the lifetime health advisory issued by the EPA, which we used as our cleanup levels. And so since then, in August 3rd of 2020, we adopted 2 new criteria to replace those under Part 201 criteria now for PFOA, which is 8 parts per trillion, and PFOS at 16 parts per trillion. So those are now what we're adopting, and we'll look at that a little bit later, how that changed a few of the maps here to a few of the wells that became actually exceeding criteria when before it was not. So I'll make mention of that later. Next slide, please. Okay, here's the recent investigation survey, or summary rather. As you recall, last year we presented the soil sampling results indicating the locations of PFAS in many of the fields that exceeded the drinking water protection values. So we went through and looked at those, and we had a multi-agency meeting in August of 2019, and we discussed what to do about that and what wells, drinking water wells, to consider for additional sampling. So initially, in a phased approach, we identified all of the private drinking water wells in our database that were 50-foot screen or less that were downgrading. And that's a tricky word, downgradient, meaning when you think of water flowing on your basement floor, it goes to the lowest spot. Similarly, groundwater moves in that capacity, so it goes downhill as well underneath the ground. So when I say that, I'm referring to the kind of the direction of flow of groundwater. Okay, so we had that multi-agency meeting. And then subsequently identified wells that were down gradient of those fields. And I'll speak to that in a little further. And then we actually went out and sampled those wells. As a result, we identified the locations, or rather additional exceedances at Hazelwood and 2nd Street. And consequently, we went out in September September of 2019 through, we issued filters and bottled water to them through the local health departments for those exceedances that were on both Hazelwood Drive as well as 2nd Street. And then in September 2019 through January 2020, we went out and collected the additional residential samples within both Hazelwood Drive and 2nd Street areas to evaluate the extent of the PFAS within the residential wells in those areas to ensure other residents were not impacted. And indeed, we did identify additional PFAS areas. Next, we conducted a focused kind of a soil and groundwater investigation right at the Hazelwood area within the field next to it, as well as between and at Hazelwood. And we'll get to those figures later. And in July through September, we conducted oversight of the Menasha landfill investigation, and we'll touch on that. Lastly, we sampled additional residential wells next to those fields with PFAS. Next slide, please. And this is what I want to quickly touch on here. This is a kind of a complex slide, very kind of hard to understand. And I think I presented this before. And I've kind of enhanced it a little bit by providing a blue line that essentially kind of bisects this figure. And that's really the Kalamazoo River here. And so the arrows, the blue arrows there kind of depict the regional flow of groundwater towards the river there. So to the north, groundwater is flowing regionally. To the south, towards the river. If you consider it like a river valley, it's the lowest spot. And similarly, the groundwater flow from the south is actually flowing north towards the river. So it kind of converges on the river. And so when I talk about gradients, I'm talking about that direction of flow in effect. So we'll get to that as well in a little bit here as well. So what you see on here, and it's a little bit hard for you guys to see, so I'll describe it a little better, is you see the fields that we identified PFAS denoted in purple there that exceeded criteria. And so what we wanted to do is look for the wells, private wells that were 50 feet or less that were down gradient or on the downward side of a field. So if you can see my cursor here on this field here, down the north side of it, which is where my cursor is, would be down gradient of that. Anyway, so we looked for the wells that would be flowing from those fields that would contact PFAS or have it leach from there. We'll talk about that a little bit later. So we identified these wells. The green wells are deep wells. The red ones are not as deep. So we identified the red wells to sample. Next slide, please.
Chris, we're working off my cursor, so I'm happy to point where you
I'm sorry. Okay. Yes. Okay. No problem.
Okay.
Okay. So this figure here identifies the shallow wells that we identified for additional residential well sampling for PFAS analysis specifically. And so you can kind of get a sense of where we sampled there for the shallow wells. Okay, next slide. Okay, so this slide depicts the previous PFAS, all the residential wells that we've sampled before. The green denoting the non-detects for PFAS, the orange denoting the less than 70 parts per trillion for the sum of PFOA and PFOS within the wells. Yes, thank you. And then lastly, well, actually that's the yellow and the orange there. And then the red indicating it's exceeding at those locations, the 70 parts per trillion lifetime health advisory. And you'll note there the two red locations, actually those are to the north, that is the Hazelwood area, thank you. And then to the south, that is the 2nd Street area. And we'll focus on those here shortly as we proceed through this. Next slide. Okay, so again, the Hazelwood Drive and 2nd Street, I'm just gonna do a quick summary here. We did that from September 2019 through January 2020. I think we were in the process of doing that during the last meeting that we had in October of 2019. So Eagle, we collected a total of 16 residential water samples on Hazelwood Drive for PFAS analysis. Of those 16, 12 samples exceeded Part 201 criteria. And I'm presenting the new criteria here, not the 70, but the new PFOA criteria of 8 parts per trillion. So 12 of the 16 samples now exceed, and you'll see that reflected in the following figure. 3 samples were below the Part 201 criteria of 8 parts per trillion for PFOA, but were above non-detect levels. And then lastly, 1 of those 16 samples was non-detect for PFOA. And then similarly, of those 16, 1 sample was below Part 201 criteria for the newly issued criteria for PFOS of 16 parts per trillion. And then 15 of those samples were non-detect, or no PFOS was detected within those 15 of the 16 water samples. And then similarly, Eagle, we collected additional 26 residential water samples on 2nd Street for PFAS analysis as well. 6 of the samples exceeded the new criteria of 8 parts per trillion for PFOA. 1 sample was below the Part 201 criteria of 8 parts per trillion for PFOA. And lastly, 19 samples were non-detect for PFOA. And then lastly, we had 26 of those samples. All 26 samples were non-detect, or nothing detected of PFOS in those samples. Next slide. Okay, this slide depicts the 2nd Street residential area where we did the initial sampling and then the follow-up sampling. And here you can see these dots here are compared to the 70 parts per trillion lifetime health advisory. So it'll change a little bit as we go to the next slide, and you'll see here we have 4 red dots exceeding criteria of 70, and that'll increase to 6 as we go down to a lowered PFOA criteria of 8 parts per trillion. Next slide, please. Okay, as I noted there, again, you can see the 26 samples in total. Now you can see the 6 red dots as we've increased or lowered the criteria for PFOA here. So you now see 6 samples exceeding that criteria. And the large majority here beyond that are below criteria and in fact non-detect, with up towards the northwest, an orange sample there denoting that it was detected but below criteria of 8 parts per trillion for PFOA. Next slide, please. Okay, this is the PFOS sampling results. Again, as I noted in that earlier slide, there were a total of 26 samples collected. All of them were non-detect for the PFOS that was sampled and analyzed for at Vista Labs. Next slide. Okay, and now here we're at Hazelwood, and Hazelwood Drive in Otsego here. You can see, and if you could point that out, that where all the samples are located, that is Hazelwood Drive there. And it kind of has a circular end to it, kind of wraps around, comes back around. And that's where we collected the previous samples, 16 samples. And you'll see these, again, are all compared, all the analytical results are compared to the lifetime health advisory of 70 parts per trillion, which is the sum of, again, PFOS and PFOA. And you'll see that that changes significantly with the new criteria on the next slide. So here you'll note that we have 4 exceedances of the 70 parts per trillion LHA, lifetime health advisory, and we'll go to the next slide. And you'll see significantly, I believe this is 12 total samples exceeding PFOA, 8 parts per trillion. So it really changes considerably in this instance when we change the criteria. And you'll note that there's the vast majority are now exceedances of PFOA. Next slide. And again, this is 2nd Street here, or excuse me, Hazelwood Drive for the PFOS results. Again, we show the non-detects in green here, that nothing was detected of PFOS in the residential samples here, with the exception of 1 well here, where it did indeed, it was not above criteria of 16 parts per trillion, but it was not non-detect either. So Next slide. Oh, and let me mention that. And so to the south is this shading area of where we did soil sampling using the incremental sampling of taking numerous cores within that field, where we did indeed identify PFAS in the soil. And we'll get to that in a second on the next slide in the Hazelwood investigation. Next slide, please. Okay, again, this is the Hazelwood Focus Soil and Groundwater Investigation Summary. So we began this summary, or rather the investigation, in March of 2020. And I think activities were suspended on March 23, wherein we had probably about 50% of the work completed. But because of the COVID lockdown, we were required to discontinue field activities. And consequently, those were restarted in June of 2020, where we completed the investigation. So in that investigation, again, included a total of 4 borings where we collected both soil and groundwater samples at each of those locations. And I'll give you a quick summary here of the analytical. The Eagle collected a total of 4 groundwater samples, or rather locations, for PFAS analysis. So PFOA ranged from 11.8 to 267 parts per trillion. So it's fairly significant levels of PFOA identified within these. And you'll see a cross section here shortly depicting those, the analytical and how deep they went, these borings. And then similarly, PFOS had also ranged from non-detect to 56.1, significantly lower than the PFOA, but certainly still there in several of the groundwater samples. And then lastly, we collected a total of 15 soil samples and had them analyzed for PFAS, both for PFOA. We had all non-detect, and that's parts per billion. And for PFOS, they range from non-detect to 15.9 parts per billion. Next slide, please. Okay, this slide is a little bit small, so it's hard for you people to see. But again, what it depicts are the 4 locations of the borings that we conducted here. 2 are located in the field to the south of Hazelwood Drive and Centennial Street. Centennial is the street in between, where we conducted a kind of a boring in between Hazelwood and the fields. And so there you can see the locations of them, and those lines there depict the potentiometric surface, big word, the groundwater flow. So basically, we demonstrated that the groundwater flow was going from south to north, and that's what that's intended to show here. And again, the borings 1, 2 are located in the field, 3 is in the middle, and 4 is to the north. They're located right at the end, or towards the western end of Hazelwood. Thank you. Next slide. Okay, and again, this one's very hard to see. It's got a lot of data on here, so I'm not going to try to read everything in here. I kind of summarized those in the previous slide of the concentrations of PFOA and PFOS. But again, what these represent it's kind of like a piece of bread. You cut away and you're looking at a slice through the ground and looking at the borings that we did. So VAS 1 and 2 are located on the left-hand side of the screen. If you can see those 2 lines, the vertical lines there, those depict 1 and 2 that are located in that field. And it's a little bit hard to see, but the orange on there denotes the locations of the soil samples that were collected. And then on down, you'll see the water samples located. And so next to each of those, you see the analytical for PFOA and PFOS next to them. So the red primarily is the PFOA, and most of those, in fact, all of the red is an exceedance of the current criteria of 8. And red on the next column immediately adjacent to that, most of them are blue, but at the top there and the first boring there, number 1, you see some of them are red. So there's some exceedance of PFOS. So PFOA in the left-hand column, and then to the right-hand column, you see the PFOS. And so the blue indicates below criteria of 16 parts per trillion for the PFOS. So you'll kind of see that as you look through there. They're detections, but they're not non-detect, and they're certainly there. So these borings extended down from the surface at 105 feet and 110 feet. So we went a long ways down, and we still identified PFAS at depth. Okay, and so again, if you look at this, the C there, or the boring on the far left, depicted by the vertical line there, is the first boring. That was to the south. And then all the way to the north, on the far right-hand side of this figure, is the VAS4. And that's the boring that we conducted at the end of Hazelwood Drive there. And again, the groundwater flow is from left to right, or rather south to north in this location here. And again, we did not find much PFOA in the soil. We did find some PFOS, very limitedly, but we certainly found both PFOA and PFOS in the groundwater, and not just at the first two borings in the field, but also in between the fields and Hazelwood, and then lastly at Hazelwood as well. So the intent of this investigation was to identify a source where it could be coming from, these fields. We took samples at the surface and all the way down in the groundwater, soil and groundwater, and then tracked it through the groundwater all the way to Hazelwood. And that was the intent of this investigation, to kind of connect the dots. And so we're very pleased with that investigation, how it's gone so far. And you'll be able to see these slides a little bit closer if you download these figures. Next slide, please. This is just basically a photo of the geoprobe that was used, and that basically advances. It's a push technology whereby soil samples are collected and extracted from the ground, and then collected in a container and sent to the laboratory for analysis after logging them. And similarly, we extracted the groundwater samples all the way down in that similar fashion by inserting a tube down the middle of these rods. I think Pam McQueer came out and took some pictures as well, and kind of investigated or took a look on behalf of the CAG to understand what's going on and get a sense of what we're doing as well, which we appreciated. Okay, next slide, please. Okay, and I'm not gonna belabor this either, because there's a lot to it. We took a lot of soil samples, we took a lot of groundwater samples as well as surface water samples. So we've been working with Menasha and their consultants and requesting that they submit a work plan to conduct additional work at the Menasha landfill and surrounding area to investigate the soil, the groundwater, and the surface water. As you recall, we presented some of those results previously of our work that we had conducted out there, wherein we collected some groundwater samples from the wells. We took some of our own surface water samples, as well as surface water. Yeah, actually two types. And I'm not going to show all of that. I'll show some of the soil samples actually that we did collect from the actual landfill, and some of the results of that, just to remind you of what we identified there. And so, as part of the work plan for Menasha, we wanted them to further investigate what we had identified and uncovered to further evaluate the impacts of in and around the landfill. So in May, we had met with them and approved their final work plan with revisions and comments, and they made those changes to the plan, and then began actual field work with their consultants to actually collect the soil, groundwater, and surface water samples in July of 2020. And then so we did oversight. We had our contractor, AECOM, conduct continual oversight at every boring. There were a total of 8 borings that were conducted. We collected a soil sample at each and every interval of soil, as well as the groundwater samples that were collected from the wells, temporary wells that were installed, as well as some of the water samples that were collected. Stand by one moment, please. Just logged out. Okay. And so we collected a total of 58 soil samples and had them analyzed for PFAS. As well as the surface water samples. So the surface water samples included some sampling in some of the ponds that we had identified or sampled before, as well as attempting to duplicate samples of runoff during precipitation events along the north side of the landfill just before the surface water entered the surface water pond located to the north of the landfill. Next slide, please. Okay, and this is what I was mentioning. You've seen this before in a previous presentation. And again, what this depicts is the locations of the soil sampling that we did. The surface of the landfill, or the landfill cap, which is about a 2-foot or 18-inch to 2-foot cap The intent there was we wanted to understand what's in the cap material. So we specifically only sampled what, the top portion of the cap in a process whereby we collected a total of 50 soil cores. That's denoted by those yellow dots there. We also did 2 borings there, just to remind you of the waste material within the landfill. And you'll see very high levels of PFOS and PFOA in parts per billion, which is much higher than parts per trillion in the cap material. And that's noted in this sample here, or the MLFDU1. Next slide, please. Okay, and again, this is a little bit hard to see. The squares there, the orange squares, are the locations of the borings and that were installed and where all the soil samples were collected. And you can look at these a little bit closer later. We collected soil samples, and basically it identified both PFOA and PFOS within the cap material at fairly elevated levels in the parts per billion range, and as well as much reduced numbers in the waste material. And we'll show that in some subsequent cross sections here that kind of depict both the soil and the groundwater locations and samples. Next slide, please. Next slide. Okay, great. Okay, so this depicts basically the drill rig that we had on site doing the borings. This is called a hollow stem auger technology, where you advance a sampling device down the middle of it, and that advances beyond the extent of the augers and collects a sample of the undisturbed material, and then you bring it up and log it and sample it. It's a little bit different, more invasive than the geoprobe used in the Hazelwood investigation, but allows us to get much deeper here, because we tried to do this previously, Eagle did, to collect samples, and we were unable to go deep into the landfill material, given the waste material present. Okay, next slide, please. Okay, again, you can see the, hold on 1 second, I got some, okay. You can see the back of the drill rig there with the auger sticking up and them advancing a rod in there with a sampling device connected to it to collect the samples. And then what comes up is a split spoon, whereas they open it up and you can see the core material there. And so it's a little bit hard to see, but what you do see there is some combustible material or combusted material from the operations that were placed in the landfill. And you can see that brown, if it's clear to you or not, that there's some brown material there that was the paper pulp that we identified in this particular core, and sampled that as well. Okay, next slide. And this is one of the cross sections that I was discussing earlier, and this is an interesting one. You can see all 3 temporary wells that we installed at the landfill there, and we wanted to understand if there's perched water, and perched water means water that is above the ordinary or the groundwater table at the site. And as you can see on the far left, or maybe you can't see it, but I'll describe it. That's a well that's located to the southwest of the site, and the groundwater is depicted or denoted by that blue, a little bit further to the left, That's a temporary well. To the left, right there. That's a well. So that blue there that's the groundwater in the area. It's that deep, and whereas within the landfill, there's some perched pockets of groundwater as well, and we'll get to that in a moment on the next cross section here. And what you see here again is similarly, the orange denotes the locations of the soil samples that were collected all the way down. Following the collection of the soil samples at each of these locations, a small temporary well was advanced down through the middle of the augers and left in for approximately a week so that the water levels would stabilize. And then we sampled it as well. Both Eagle sampled it. We took the split sample of it as well, sent that off for PFAS analysis at each of these 3 locations as well. And each of them did indeed have both PFOA and PFOS levels, although they were not nearly as high as the surface water samples collected around the site. And we'll talk about that here in a minute as well. So again, this cross section, it goes from the southwest corner. You kind of see an inset there. So if you can kind of hover over that, it's called AA prime, this cross section. It's a little bit complex, but yeah, it's the line in there that goes from bottom left to upper right there. So southwest, yep, all the way up to the northeast. Thank you for doing that, Sue. Very helpful. And so the other one, the next one will be from the northwest to the southeast, and we'll go to that right now. Next slide, please. Okay, this one's a little bit easier to understand insofar as that the pond that I'm speaking of that's immediately to the north and adjacent to the landfill, you can see it in that small inset as well as in the cross section here. So that line that goes from in the inset there, if you kind of hover below in that picture, the inset, Sue, that picture where the landfill, or the cross section, that's from the northwest and it extends down to the southeast through the site. So if you picture it kind of slicing it like a loaf of bread and you split it apart and you can see the side of the loaf of bread inside of it. That's similar what the cross section is intending to do here is understand what the subsurface material looks like. And basically what you see here, and again, that goes through several of the borings that we did. We've identified the various types of landfill material, waste material there, and identified very similar levels of both PFOA and PFOS within the waste material in the landfill. And again, not real high levels relative to what we find in the surface water and as well as in the cap material. And the cap is depicted by that narrow, thin gray line at the top of the cross section there. If you kind of go up that slope there, yeah. So that's basically the landfill. And so if you go to the left, yes, and that's really to the north, that landfill, basically the water that goes down that landfill, originally there were some drainage swales to help direct the water away and around to other areas. But in fact, a lot of this water goes right into that surface water pond to the north, or on this figure to the left. And so we did indeed, as you recall, we collected some surface water samples, and the PFOA and PFOS numbers were very, very similar in concentration and in distribution of PFOA and PFOS within the surface water ponds. So we did indeed confirm that again, both Eagle did with our split samples as well as the other samples collected by Menasha and consultants. And one other thing to note here is, and again, you can see or rather, I'll describe it, the three boring locations on here, and you'll see again the blue dot or blue upside down triangle there, that depicts or denotes the location of the groundwater, the perched groundwater that's elevated. It's much higher within the landfill, likely because it's caught on some clay layer or something. And as you'll note, that may or may not contribute because it has PFAS within the groundwater samples there's a connection potentially through the sand layer. If you go to the left of to the last boring or not the boring, but the well there, Sue, to the left, a little bit more, right there, yeah. So that's a well that we know is there, and it's much deeper, the groundwater there. But if you go back up all the way to the top, almost to the sand, right there, there's a sand layer depicted next to the water in the pond in that previous boring. That's very similar, and that's a sandy layer that likely conveys some of that perched water into that. So it could be a likely contributor to the contamination within that pond, but we think and have demonstrated that it's much higher coming off the cap, because the actual cap material, that thin line on there, does contribute high levels of PFAS to the pond. So next slide, please. I'll keep it moving here. And similarly, these again depict the locations of the Menasha landfill groundwater that we just discussed, those three locations. I won't belabor that too much. Next slide, please. Again, these are the surface water samples I was just referring to. They're, again, very reflective of the PFAS numbers in the pond there, as well as the samples that we collected during precipitation events off the landfill that were actually on the landfill cap of surface water that was draining into the pond during rainfall events. Next slide, please. Okay, and then lastly, the additional residential well sampling that we conducted in September through October this year. Based on the Hazelwood investigation, we identified PFAS at much greater depth than initially anticipated through the hydrogeo or the soil and groundwater investigation. So initially we had sampled wells with shallow screens. Now we identified the rest of the wells that were downgrading of any of the fields that had PFAS exceedances. And so we identified 15 wells where groundwater would potentially move through the fields vertically through the soil down to the groundwater and then move within the groundwater, similar to the idea of the Hazelwood investigation. So we identified 51 wells, sent out some letters to the residents. We received 38 responses and sampled 38 residential wells and for PFAS analysis. Of those 38, 2 samples exceeded Part 201 criteria for PFOA, which is 8 parts per trillion. So 2 out of 38 exceeded criteria. 2 of those didn't exceed, but did have detections, but they were below 8 parts per trillion for PFOA. And the balance of the 38, or rather 34 here, were non-detect for PFOA. So nothing detected for PFOA in those 34 of those 38 samples. And then similarly, 1 sample was below criteria for one sample for PFOS for the 16 part per trillion criteria for PFOS, and the balance 37 samples were non-detect for PFOS in those residential samples. Next slide, please. Okay, so this is a compilation of what we've done previously of all the residential well sampling, and then the triangles denote the locations where we recently collected the 38 additional samples, and these are compared to the PFOA criteria here. And so the triangles here denote where we have newly identified locations in the recent 38 samples collected in September through October for PFOA exceedances. And you'll note some of them are green triangles there down on 2nd Street, if you can identify that. Yep. And then up to the north, you'll see the red for Hazelwood, where you see the red triangles. No, so further to the east, a little further east. Yep, there you go, the collection of red triangles. That's Hazelwood there. So, okay, next slide, please. Again, this is the results for the PFOS sampling, and you'll note that there's an absence of PFOS for the most part in the residential drinking water samples. You do see there's a red dot that is in the far top left there that previously was not a red, that was an orange, wasn't above the 70 parts per trillion, but now it does exceed the PFOA, or excuse me, the PFOS criteria. So, and again, the triangles represent the recent samples collected near the fields, and the green is the previous, from the previous 2019 sampling efforts. Okay, next slide, please. Okay, lastly, Otsego area study next steps to continue to work to identify other sludge application fields with targeted residential well sampling down gradient or nearby those fields. We're in the midst of working to work with various individuals within the community, and conducting interviews with them to help us identify those fields, and then potentially do additional residential well sampling near those fields. And then also, you'll note, so some of you have visited the area of interest project site on the Michigan.gov PFAS response website. You'll see this is under area of interest, the Otsego area study, but it's being changed to, we're in the midst of changing it to a PFAS site because we have now exceedances of the groundwater criteria for PFOA within the groundwater samples, not specifically the residential samples. And then lastly, although it's not noted, we're going to continue to do oversight of Menasha and their contractors of the ongoing investigation studies at the Menasha landfill and surrounding surface water areas. So with that, that's basically my update today, and hopefully that was beneficial to you. And I'll turn it over to Bill Farrell at DHHS to continue on.
Hi, everyone. My name is Bill Farrell. I'm a toxicologist with MDHHS, and I'm going to talk about a couple of things. First of all, I'm going to talk a little bit about the role of public health in this investigation. And then I want to touch a little bit on MDHHS's process to determine to assess a hazard and determine if there's a potential public health concern. And then I'll finish up my talk talking a little bit about PFAS chemicals, general information, what we know regarding their toxicity and that type of thing. So, next slide, please. The role of public health. Basically, we're here to understand the health concerns facing the community. We develop a plan to investigate and determine if there is a public health concern. And EGLE is the agency that typically leads the site investigation. And MDHHS and the local health department lead the public health planning and response. We evaluate environmental chemical exposures to residents in the community. And based on the evaluation, we recommend public health actions as needed. Next slide, please. This slide kind of gives describes what our process is to determine health concern at a site. And basically, I just want to kind of go through this so that people can understand how we look at things and what we do with respect to data that's collected and that type of thing. So basically, the first step is hazard identification. Basically, it's to determine if there's any particular situation or activity that has the potential to cause harm to individuals. And with respect to the Otsego site, what we looked at as far as a potential hazard was the historical paper making operations. And in particular, the activities associated with application of paper making sludge to fields, to farm fields. So once we've determined the potential hazard, we need to identify if that potential hazard can cause harm to individuals. And the way we do that is we try and characterize and quantify exposures that people may have to chemicals or anything associated with a hazard, okay? And this characterization, this quantifying exposures is probably the most important step in our process. And I'm gonna talk a little bit more about that in the next slide. And then, once we've characterized and quantified exposures, we use that information to assess potential for adverse effects from the environmental exposures. And then based on that assessment, we recommend sound public health actions based on the scientific evaluation. And these public health actions could include anything from maybe recommending further investigation because we have an inadequate data set. We could recommend actions to reduce or eliminate exposures, and we could recommend more comprehensive studies or evaluations, such as public health assessments, epidemiological or health studies. So next slide, please, Sue. Now I want to talk a little bit about this characterizing, quantifying exposures. And this slide kind of lays out three steps in this process. And the first step, we characterize the exposure setting. Again, with respect to the Otsego site, we determined that these sludges had been applied to farm fields historically. So we try and figure out how people could be exposed to chemicals that might be associated with those sludges. So in doing that, we basically try and identify exposure pathways. So with respect to the Otsego site, we have these sludges that have been applied to the farm fields. And these sludges contain chemicals in that are associated with paper making operations. And these chemicals can leach from the sludges and migrate downward and get into groundwater. And once they get in the groundwater, they migrate with the groundwater. And there's potential for them to come into contact with people's drinking water wells. So in the second step, we've identified this exposure pathway. We've got the chemical source, which is the sludges that are applied to the farm fields. The exposure point are the residential wells where people could draw water that contains these contaminants and then the exposure route is drinking the water. So once we've identified that exposure pathway, we want to try and quantify the exposures via that pathway. And this is where we work with Eagle to come up with investigation plans to do sampling. And basically, with respect to the Otsego site, as Angelique and Chris pointed out, we started out originally sampling 56 residential wells. And we sampled those wells for over 200 different analytical parameters. And again, these are chemicals that, that could potentially be associated with paper making operations. So we did the sampling of those initial 56 wells, and we identified about 10, I believe, 10 to 12 or something that had detections of PFAS in them. The other constituents that we analyzed for, we didn't, either were non-detect or they were below health-based values. So once we determined, we found these PFAS chemicals, we started focusing on these farm fields. And as Chris mentioned, we've collected samples of the farm fields to assess the absence presence of both PFAS and dioxin chemicals. And then based on the results, we detected PFAS levels, and we've done targeted sampling of residential wells in the area of these farm fields. So as a result of that sampling, as Chris pointed out, we've identified 2 specific areas where we found elevated levels of PFAS above our health-based values. So that brings us, next slide, please. So that brings us to PFAS. This is the chemical of concern that we've identified from this sampling these residential wells in the farm fields. And PFAS chemicals have been around for years. They've been around for 50 or 60 years, and they've been used in all kinds of different industrial and consumer applications. This slide just gives you an idea of some of the different industries and consumer products that PFAS chemicals have been used in. Next slide, please. So why the concern with PFAS? Well, as I mentioned, they're used in all kinds of different applications. So there's the widespread use and the widespread presence of these chemicals. And these chemicals, they're often referred to as forever chemicals because they don't break down easily. They're very, very hard to get rid of. They're composed of one of the strongest chemical bonds known, the carbon-fluorine bond. And as a result, they don't break down very easily. And these chemicals are known to bioaccumulate, both in wildlife, such as fish and deer and that type of thing, but also in humans. And there are some adverse health effects that have been identified associated with exposure to PFAS chemicals. And PFAS are referred to as emerging contaminants in that we don't have a lot of information regarding these chemicals. And because we don't know a lot about those chemicals, there's a lack of standards for managing these chemicals. Next slide, please. So this slide shows the average concentrations of PFAS in the blood of people in the United States. And basically what this slide shows is that in 2000, and as part of studies that have been done for years, they started collecting samples of people's blood in the United States and analyzing those blood samples for PFAS. And this slide shows that in 2000, the average concentration of PFOS, in the blood of people in the United States was about 30 parts per billion or 30 micrograms per liter. And PFOA, the blue line, the average concentration was about 5 parts per billion. Now, the interesting thing to note about this slide is that as you go from 2000 to 2014, you see a dramatic decrease in the average concentration of PFOS in people's blood. And the reason for that is that in 2002, the United States banned the manufacture and use of 2 specific PFAS, the PFOS and the PFOA, in products produced and manufactured in the United States. So as a result of the banning of those 2 particular PFAS chemicals, you've seen a decrease in the amount of those particular PFAS chemicals in people's blood, because basically there's been a decrease in exposure to those particular PFAS chemicals. Okay, next slide, please. Next slide, Sue. Yep. This slide shows some of the associated human health outcomes associated with exposure to PFOA and PFOS. And most of the information that we have regarding the toxicity of PFAS chemicals comes from epidemiological and animal studies of two specific PFAS, the PFOA and PFOS. And as is shown on the slide, some of these health outcomes include lowering a woman's chance of getting pregnant, increasing the chance of high blood pressure in pregnant women, increasing the chance of thyroid disease, and increasing cholesterol levels, and changing the immune response, and also increasing chance of cancer, especially two particular cancers, kidney and testicular cancer. Next slide, please, Sue. So now I'm going to talk a little bit about how we evaluate these residential well drinking water results and what we look at when we're making our determinations for public health response actions. So we have multiple lines of consideration that we look at. We look at MDHHS comparison values. We look at the residential well results, both individually and collectively. And we also look at any site-specific information that we have, information regarding the geology of the site, the known sources, groundwater flow, and that type of information. Next slide, please. So this, the MDHH comparison values. The MDHH comparison values are basically the lowest of our MDHHS public health drinking water screening levels, or the MPART health-based values, or MCLs, commonly referred to as MCLs. Both the MDHHS screening levels and the MCLs were set to protect everyone. And this includes the most sensitive populations, such as fetuses and breastfed babies. Next slide, please. So this slide shows the MDHHS comparison values. And again, we have comparison values for 7 PFAS chemicals. And Chris talked a little bit about PFOA, the MCL 8 parts per trillion. PFOS, the MCL is 16 parts per trillion, but we use a comparison value of 8 parts per trillion. And then you see the comparison values for some of these other PFAS chemicals. Next slide, please. Now this slide kind of gives you an example of how we evaluate residential well results, basically both individually and collectively. And what I want you to pay attention to is you look at the house highlighted in yellow in both figures, on the left and on the right. And you see this particular house, we look at the result, and the result is the same. We've got detections of PFAS below comparison values. But when you look at the houses surrounding that particular house, the figure on the left, you see the houses shaded in blue, which means that there were no detections of PFAS chemicals. And then the figure on the right, you see the houses shaded in red, which indicates exceedances of PFAS levels. So even though this particular house has the same result, when I say this particular house, the house shaded in yellow has the same result, because of what we identify with the homes around them, what's going on around them, we would make different public health responses for that particular house in those two particular different scenarios. So that's what I mean when we say we look at the results both individually and collectively. Next slide, please. Now this slide kind of outlines some of the public health response actions that we consider. And when I say we, I mean both MDHHS and the local health department. There could be no public health actions necessary. And a lot of times we recommend a filter or use of alternative water. And that recommendation in many cases isn't made necessarily because the levels of PFAS in an individual's home's drinking water well may be of concern, but it's made more because we need to understand what's going on long-term. We don't know exactly what's going on, so we need to buy time to do more investigation to understand what conditions would look like in drinking water wells over time. So the filter provides the residents with protection from potential fluctuations in PFAS levels while the investigation is ongoing. And in other situations, we could also just provide education. In a case where individuals may have some low levels of PFAS in their drinking water, we just kind of provide them with information about PFAS and information on things that they might be able to do to reduce their exposures. Next slide, please. So as far as the next steps, Chris already mentioned that we can continue to work to identify other sludge application fields with targeted residential well sampling. And MDHHS is also working on completion of the public health assessment for this site. So with that, I think I'll turn it back to Sue.
Yeah, thanks, Bill. All right, now it's time for our question and answer session, and we want to hear from you. We want to learn what questions you have. We want to learn about your concerns. And Angelique, Chris, and Bill are here to answer those questions, as well as some other Eagle and MDHHS staff. And Mark Johnson from ATSDR is also with us as well. First, we're going to have Les give us a refresher on how to ask a question.
Thank you, Sue. For our attendees that joined us after we conducted the housekeeping earlier, thanks, Sue. Again, if you have a question for the presenters this evening, please type your question in the Q&A box located in the Zoom control panel at the bottom of your screen. You may also choose to raise your hand, to electronically raise your hand by selecting the hand icon that is also on the Zoom control panel. And I see we have a couple of people already who are selecting that option. And then we have several on the phone. We've had up to 5 attendees on the phone this evening. So if you're on the phone this evening and you have questions for the presenters this evening, you may also electronically raise your hand by selecting the star key and the number 9, and we'll be monitoring for that. So those are the ways you can communicate with the presenters this evening. And Sue, if you're ready, we'll just monitor for questions.
Yeah, I'm ready. So I will read the questions that have come in, and we'll have one of our presenters respond to those. So our first question is this presentation going to be made available after the webinar? And I guess I can answer that question. The answer is yes. It will be posted on the ATSEGO webpage. And after we finish this Q&A session, I'll show you how to find that. The second question is there an overview map of all of these locations? Chris, that might be a question for you.
Sure. And I think it was answered below. There is indeed an overview. I think he responded later. Oh, yes, found it. Or maybe not. Someone different. But yes, there is included in the presentation. Those are in that presentation. I know I went a bit an expedited fashion, but that will be available. It will be in the part of the presentation, but it will also be posted on the PFAS website, soon to be elevated from an area of interest to a PFAS site. So the text on the current area of interest reflects the current work conducted. We just have to add some additional figures to make it fully updated.
Sounds good, Chris. And I know we have a question from Jay, who then later typed, never mind, I found it, but some other people might have the same question, so I'm going to read it anyway. What's considered the source of PFAS, and how was it first identified as a possible contaminant to measure?
That's a good question as well. Initially we didn't suspect it as being one of the for sure contaminants out here. And as many of you know, when we initially started the investigation out here in the sampling of the initial 60, it was initially 56 wells, then we did an additional 6 wells. So it was 62 in the first event in effect wherein we did up to 200 different compounds that included volatile organic compounds. It included, as you recall, the dioxins, which were mentioned briefly by Angelique. We did include PFAS, but a whole host of metals, all the various inorganics that were done. And basically, and I think Bill alluded to this, those were all below criteria with the exception, for the most part, of PFAS. And so then we started to suspect, hey, where did that PFAS come from? Is that something to do that's possibly within the paper sludge, potentially? So we went back and went through some of the records that were provided to the EPA as part of the Superfund site from Menasha. It's called 104E. We went through those and identified many of the fields, not all of them, and certainly not the locations where all of the sludge has been placed, but we identified many fields that we thought we would be comfortable in identifying and sampling the soil for PFAS. And indeed, we did identify PFAS in many fields. Not all of it high values, but some of it exceeding criteria. So that is, and similarly, the Menasha landfill summary that I just briefly went through, we did indeed identify the PFAS within the cap material of the actual landfill, the top 6 to 8 inches that we collected soil cores from. And interestingly, I believe the records reflect that the cap was initially constructed of clay material, which is very common in landfills, but also mixed with some paper waste as well. And hence we suspect that some of the paper sludge contained some PFAS, which was also placed on incidentally on some of the fields. And so we suspect that there's a connection there.
Okay. The next question is from Jonathan, and there are multiple questions, so I'm going to read them one at a time. What is the geology at the site? And I think you've partially answered that, but.
Sure. And that's a complex question given the actual size of the site. When we say the site, well, the site encompasses many fields. And of course, we didn't do soil borings at depth at every field. We did it at one location, specifically Hazelwood Drive, where we did those 4 borings. And that identified primarily sand and gravel in that location, which we suspect allows for the migration of the PFAS contaminants vertically down through the sand and gravel. It mobilizes quite easily through that, as opposed to something that's tight like a silt or a clay, which is absent in those borings. So we suspect that it moved, and that's why we identified it in the samples down to 100 and plus feet, 105, 110 feet below ground surface. And then lastly, the Menasha landfill, that I briefly touched on those. You can look at it later in the presentation. You can see what the geology subsurface is comprised of there. And there's layers of silty clay, sandy clay, and sand layers that conveyed some of that perched groundwater, impacted PFAS groundwater towards potentially the north surface water ponds there as well.
Okay. And again, you've partially answered this. Were there any preferential pathways?
Yeah, and yes, partially I did. So we haven't evaluated everything, of course, but there was a sand seam there where that perched water at the landfill specifically, it appears to have the same elevation as the surface water pond, where we identified very high levels of PFAS. And so we suspect that though there may be some seeps coming out of the northern side of the landfill that help contribute to some of the high levels of PFAS within that surface water body. However, the levels that we find in the surface water that emanate from the cap during precipitation events is much higher and very similar in concentrations, PFAS concentrations, to the actual pond. So we suspect that's the larger contributor of PFAS in that specific case. And then lastly, the preferential pathway at the borings in the farm field at Hazelwood, we suspect it's just preferentially going down toward the groundwater, given that it's a sandy, gravelly subsurface lithology there.
Yeah, and there's one more question here. And if you have anything else to contribute, Chris, what is your theory on why PFAS contamination is present at 100 plus feet below ground surface?
Yeah, and again, I think I mentioned that briefly at Hazelwood in particular. The reason why it would easily mobilize is simply because PFAS does mobilize fairly rapidly. And there may be a vertical component in the groundwater that's contributing to that migration. So, the groundwater can migrate, or rather mobilize, either vertically or horizontally. So sometimes groundwater moves straight down or at an angle down or just horizontally. So in that case, I think we have the migration moving down, and or the contaminants are heavier than the water, partly as it's moving down through the water column.
All right, Chris, don't leave us. We have another question for you from Kenneth.
Okay.
Is Menasha paying for all the state, municipal, and contractor costs related to these investigations, analyses, and associated work? What about accepting responsibility for public health and individual health consequences? Are there other potentially responsible parties? And what measures are in place or envisioned to make sure the responsible parties do accept financial and legal responsibility? I think that's all part of the same question, so I've read that all at once.
Yes, thank you. Yep. Let's see. So the first question, are they paying for all of our costs so far? They are not. Much of the work that we've done so far has been covered primarily by both DHHS and EGLE primarily, with the assistance of ATSDR and the local health departments, and we have not been reimbursed for those costs yet. But I think it's premature to begin that, or actually ascribe that responsibility quite yet, but we're getting there, and we've made some really good connections, as you guys gather, from the investigative work that we've done both on the landfill as well as within the community, within the farm fields, and the source identification and connection towards the Hazelwood Drive impacted wells. Having said that, we've engaged with Menasha and their attorneys, as well as their contractors on their behalf, to develop a work plan to conduct ongoing work that we would otherwise have conducted further at the landfill. So there's been some level of cooperation there. That's a good sign. And beyond that, I'm really not. It's really more of a TBD, to be determined. Regarding your other questions, we're engaged in those very considerations and discussions at management levels currently, and not really allowed to kind of talk about ongoing or in process discussions for that at this time.
All right. Chris, we'll keep you on here for just a second. Who proposed 16 part per trillion maximum contaminant levels for PFOS? Let's have you go with that question first.
Okay, so that was developed by the PFAS MPART that helped develop that to address, hey, the current level, or the previous level used, was the EPA's lifetime health advisory of 70 parts per trillion. Not a lot was known at the time, as this is an emerging contaminant. Is it protected? Is it not? So a lot has been done at DHHS to develop those numbers, and took a lot of time to develop them, and various toxicologists to develop that. Maybe my DHHS cohorts could add to that further than I can.
All right, now this next.
Real quick, Sue. Yeah, the 16 part per trillion, the MCL, it was developed through MPART, and it was developed through, they had a science advisory board, basically just a number of scientists, experts in their fields were pulled together, and they worked towards developing these MCLs. So it was the state with assistance from this science advisory board.
Yeah, thanks for that, Bill. That's an important point. All right, there's a bit more to this question, and there are some acronyms that I don't understand. Maybe you will, but let me read it. Are carbons and resins reduced to non-detect until saturation and breakthrough? Then the carbon is removed and replaced, or IX resin regenerated. We have anion exchange resin for perchlorate, and PFAS, PFOS, PFOA, GAC 400 reagglomerated 12 by 40 mesh coal based on GAC. May we see the municipal WQR that we requested earlier? Also, dioxins have maximum contaminant levels of 0.03 parts per billion. Again, our carbon's reduced to non-detect.
Okay, so what you're referring to is your granular GAC refers to granular activated carbon, and your filtration system. What was the exact question? Who proposed? Okay, we answered that. May we see the municipal water quality results that we requested earlier? You certainly may. Those are those are primarily from our water, drinking water unit that would have those, and those are publicly available for the municipal wells from earlier sampling efforts. Let's see, also dioxide, yeah. Okay.
Chris, those municipal water results are available on the PFAS response webpage, I believe.
Yeah. Okay. Thank you for that.
All right, a question from Liz. Are all the maps shared today available on the Eagle website? And I can take that one. They will be available. The PowerPoint should be posted within a day or two, as well as the recording of this meeting. And I'll show you how to find those after the Q&A session.
Sue, I think we missed one question from Lawrence Dale-Birdie above. If you scroll up in the chat window, unless I'm mistaken, there's one about, okay, yeah, I believe one suggested action was to hook up these contaminated wells to city water. And I think specifically you're referring to the discussion along Hazelwood Drive, which I think we mentioned that previously, and we're still exploring that option. There is a water main that we've looked at and that extends north-south along 13th Street, and there's a stub that comes off a short stub onto Hazelwood. So I believe the county is in and or the township is in discussions with our drinking water personnel regarding that currently.
That sounds good, Chris.
Yeah.
All right, a question for Bill from Kenneth. The list of DHHS responses concluded with the investigation phase. What about the remediation phase for the risk of future contaminated water consumption? And what about responding to health consequences of past exposures? And Bill, this is a question for you.
Okay. Can you go ask it again? I guess
Yeah,
break
sure.
it down into the parts.
Yeah, and let me ask you, there's two questions here, so I'll ask you them one at a time. The list of DHHS responses concluded with the investigation phase. What about the remediation phase for the risk of future contaminated water consumption?
Well, I think like with respect to the Hazelwood area, they're looking at doing, trying to get people hooked up to municipal water. Other areas, you know, they pretty much non-detect or below comparison values. So I think with respect to future, I know at other sites across the state where we have PFAS levels, we look at doing monitoring over time so that we can assess long-term exposures. So those are sites where we have elevated levels of PFAS. So monitoring is one approach to, monitoring over time is one approach to assessing long-term conditions and making sure that there aren't any issues in the future with respect to.
Okay, and then the second part of this question is, what about responding to the health consequences of past exposures?
Well, as far as the health consequences, I think that's something that DHHS is working on. And I guess I can talk a little bit about the health study that DHHS is going to be doing for PFAS. Actually doing a health study for residents in the North Kent County area and the Parchment area. And these are residents who have had PFAS in their drinking water And we have a lot of exposure information for those particular areas. And they will be doing a health study to assess basically to assess the relationship between exposure and health outcomes. And then that information is used to understand PFAS, to better understand PFAS and the toxicity of PFAS. It's used by regulators to set regulatory limits. It's used by public health to set exposure guidelines that are protective of public health. So studies like that are where we get the information to identify like health consequences and that type of thing. So even though, and studies like that benefit everybody. It's not just the residents who take part in the studies, but everybody. So it's through studies like that where we try and understand the long-term health consequences from exposure to PFAS.
Okay, thanks, Bill. Chris, we might be back to you. How are you identifying those involved with sludge application? For example, which farmers?
Yeah, I think I touched on that briefly earlier, and I'll just kind of add to that again. We did go through records provided by Menasha that indicated where the locations of many of the farm fields were that had indeed received paper sludge over the years, but it's not, much of the data is incomplete. So they placed sludge on there for many, many years. And so we'll have, for instance, when we go review those files, we'll have one field and it shows it was placed on there 1 year or 2 years, but we don't have the full record of it that at our disposal to find that information. So we also had discussions with some various people within the community that could help us identify fields where they were certain it was applied and had historical knowledge and input regarding that. That was very helpful. So it was kind of a multi-tiered approach in identifying those fields. And in fact, I think my last slides of next steps I alluded to as well. We're in the process of continuing that identification activity by interviewing various people that either are in the community and worked historically at Menasha and have firsthand knowledge of the placement of the paper sludge, as well as others within the community that we've identified. So that work is being conducted through the Attorney General's office on our behalf. So that's moving along fairly well as well. So hopefully that answers the question.
All right, thanks, Chris.
Yep.
Bill, I think we're back to you here. Are the results of this testing a threat to citizens for their health?
Well, as I mentioned in my previous response to the question, we're trying to learn more about that type of situation. And one of the steps we're taking are the health studies that we're doing for the North Kent County and Parchment area, again, to understand more about the relationship between the levels, degrees of exposures and the health outcomes. So that type of information is what scientists use to get a better understanding of those types of things.
All right, thanks, Bill. Chris, if there are maps, and we know there are maps, we saw some tonight, would it be possible to have the streets labeled so they can be read? And I don't remember if you had streets labeled on those maps or if they were easily viewable. And if not, can you provide those labels?
We certainly can, and in fact, the maps that are included in the presentation, when they come into the presentation, they are condensed a bit for the purpose of moving it around between various people for editing and viewing review purposes. And so some of the definition or resolution gets lost in that process. But so we will post many of these maps online as part of the PFAS on the PFAS website, but we will also make the a PDF and or a PowerPoint with higher resolution slides that's downloadable so that there's more easily readable. And we will attempt to put the names on some of those streets, specifically Centennial and Hazelwood that I mentioned that was absent on some of those maps. So Is that helpful?
Yeah, that's great. Thanks. And Chris, again for you, and I'm going to ask you this question in two parts here. May we have a better and full explanation of the original dioxin results, how the lab used contaminated containers? Let's start with that.
Okay, and that's a good question. We do recall that there's a lot of questions and concern about that, how we identified, how we ended up with dioxin within 16 of the wells, exceeding criteria, or not exceeding criteria, but identified within the wells. So we went back and sampled our own and sent it to a different lab, and we had non-detect, as you recall. Those levels, dioxins tend not to be very mobile in groundwater. They stick to in the soil very readily. So it's very unusual that you do indeed get it in your groundwater. So we were a little bit perplexed. And so what we did is we resampled those 20, I believe it was 20 wells, and sent those results to Vista Laboratories, and during which we received the results back. And the vast majority were non-detect and or very low levels, around 1 part per quadrillion. And another explanation is we didn't identify that it was the exact bottles that they use, because you're analyzing at a part per quadrillion. And if you can think of, it goes from part per million to part per billion to part per trillion, and then part per quadrillion. So if you get a sense for a part per quadrillion, Lake Michigan and Lake Huron are 2.2 quadrillion gallons. So if you were to take 2.2 gallons of water or anything, of milk, toss it in the lake and stir it up so it's homogeneous or evenly distributed, that would be 1 part per quadrillion, very, very low levels. So when we're in the lab measuring at those very low levels, it's very easy to get some cross-contamination, whether it be, it's not necessarily that we know it was from a contaminated container. We surmise it may have been, but it also perhaps could have been from, who knows, maybe someone was smoking at the lab. They walked in with some residual dioxins and furans on their vest. It doesn't take much at all. Quadrillion is very, very infinitesimally small. And consequently, it's very easy to get cross-contamination, whether it was some of their lab equipment or the bottles provided that we collected them in, and or the conditions within the laboratory. It's not easy to identify that. So, and again, dioxins and furans are indeed also naturally occurring within the environment. We did identify them in the fields. When we looked at some of the kind of the distribution of them, the specific dioxins and furans, they kind of aligned with some of the diesel exhaust that's in complete combustion, is how some of the dioxins form. And so we don't know all the answers to it, but we certainly don't feel that those wells do have it in there. And we went the extra mile to collect samples and go to a lab that we use quite frequently under the state contract as an overflow lab. This has been a very good lab for us, very consistent in the results. So we're quite confident in those results.
Okay, let me ask you Christina's second question here. Why aren't we testing these wells for dioxin when there are well-known associations with dioxin in paper making?
And again, that goes back to my previous comment. Once we resampled 20 of those wells, and plus the original, the balance of the 62, we don't really have a dioxin problem within the groundwater. And again, we don't feel that, dioxins move. We did identify them in the fields, but they don't travel, they don't leach, they don't migrate vertically, similar to what we see in some other contaminants, like in this instance, PFAS. And so we're not continuing to analyze for dioxins.
All right. The next question is for you too, Chris, from Connie. Why was Hazelwood sampled for both soil and groundwater more than Centennial?
Oh, good question. You mean specifically the residential houses, I believe? Centennial is actually on municipal water. Consequently, there are no private wells along Centennial Court there. So we didn't sample any of the houses there. And with regard to soil and groundwater, we did one boring there and one boring at Hazelwood. So it's really, they didn't go as far down relative to the farm field. but the levels were extremely high there. At the field, we felt, and we kind of ran out of time in terms of what, the availability of our staff to continue collecting samples vertically. It's a very slow process using a geoprobe to collect water samples at depth. And the material there, some of it at depth, as we proceeded down, got a little bit more silt in there. So when you're pumping silt through a small tube, it takes a long time to clear it up so you can get a good sample for it. So I'm not saying that we identify or we understand the extent or the depth of impact at those locations, but we certainly didn't continue down 100 feet at those both locations.
Okay. Let's keep going here. We have 29 more questions to get through.
Okay.
Lawrence has a question, and again, these are acronyms I don't understand, so I'm just going to read it. Are competing TOC or BOD or COD adsorbents concentrations, ambient temperatures, and pressures to inlet?
So what Lawrence is referring to, TOC stands for total organic carbon, and BOD refers to biological oxygen demand, and lastly, COD refers to chemical oxygen demand. And so, if those are present in groundwater, or how it interacts with things, the carbon, do certain carbons within the existing groundwater and the subsurface lithology absorb some of the material there, some of the PFAS potentially, thereby not reflecting the true nature potentially of the impacts there or not. That's what his question is. Okay. Basically.
Okay. Christy has two questions. Chris, one is for you and one is for Bill. And this first one is for Bill. Can you please offer more explanation to the conclusion that no public health protections need to be taken? And yeah, there we go.
I guess, are we talking about this specific site and specific wells, or I mean, with respect, I guess there was no conclusion that no public health protection is necessary for the Hazelwood areas. Those residents have been provided filters as an interim response action so that reduce their exposures in their drinking water while we do more investigation and also get to the point where we have a final remedy. And similarly, in the 2nd Street area, we've provided filters who had detections, PFAS, above the comparison values with a filter.
All right, Bill, thanks. So we did take some public health.
Yes.
Yes. And then the second question is, what kind of monitoring and containment will be done to address the PFAS found much deeper than expected?
That's a good question. And I think I alluded to it before. That was kind of the result of our, or rather the investigation summary provided at the end of the Eagle presentation this evening, wherein we, not only did we said, hey, initially we sampled wells that were 50 feet or less for PFAS. So we went back and subsequently identified all the wells near those fields that we've identified so far for PFAS at any depth. And so that was the intent of that last summary investigation there of the residential wells that we sampled recently to identify that.
Okay. Connie has two questions and they're for you, Chris. Did you confirm that upgradient locations from the sludge field were non-detect for PFOA and PFOS?
We did not confirm that they were non-detect. They did have some detections in them. Fewer detections for, I believe there were no detections for PFOA, but there were for PFOS. Does that say PFAS or PFOS? I can't even read that.
It does say
PFAS.
I assume it means PFOS.
Yeah, I suspect it's intended to say PFOS. So that's the answer there. There were some in that field, and our original sampling efforts did indeed identify PFAS within those fields in the parts per billion range, which is much higher concentration than a part per trillion, which we find in the water. So it's much higher concentrations in the soil. And then the second question, did any of Eagle's soil or groundwater samples have any mercury concentrations in these areas? So we did not sample for mercury in these. This specifically was a PFAS specific investigation for that particular contaminant, and no mercury was included. Mercury was included in this investigation.
Question for
This is Dave Haywood. I wanted to jump in on that one.
Sure, Dave.
The initial 62 wells that we sampled in the first phase of the investigation were in fact tested for mercury, and we did not find any levels above criteria.
And Dave is also with Eagle. All right, a question from O'Day. Is there a consent agreement or any other kind of enforcement document in place to enforce Part 201 with regard to the criteria exceedances?
There is.
That one.
We got it?
Chris.
Okay. Thanks, Dave.
At this time, no, there is not a consent agreement or any other kind of enforcement document in place to enforce Part 201 with regard to the criteria exceedances. As Chris explained earlier, we're working with Menasha on a cooperative basis with regards to their former paper landfill that was located across River Street from the plant that they operated for many years, and entering into a consent agreement or any other kind of enforcement document is a process that would take place at some point in the future when we feel that we have definitive evidence that Menasha is the responsible party, and we're not quite there yet.
All right, thanks, Dave. Back to Eagle. What is the source of the Hazelwood Drive contamination?
And so what I was attempting to convey, and perhaps I didn't do a very good job of doing that, if we were to go back and look at the cross section there in the presentation, so it showed the two borings that we conducted within the field there. We suspect it's when we identified the PFAS within that very field in our initial sampling, where we took the surface cores all over these fields, we did have exceedances of criteria, drinking water protection criteria of the soil for PFAS. And so we thought, hey, that merits some further review and investigation. So we collected soil samples, not just at the top like we did previously, but we wanted to track it as it moved down in the soil column, down to the groundwater and into the groundwater, all the way down to 110, 105 feet at two locations. And as I explained, and maybe not clearly, the groundwater is moving from that field from the south, moving north towards the river beneath Centennial, where we put one additional boring where we collected soil and groundwater samples, which did indeed verify that there was continued PFOA and PFOS within the groundwater there, which we believe to be coming from that field and moving northward, and then ultimately northward towards Hazelwood. So to be more succinct, we believe that the source for the contamination at Hazelwood Drive to be likely a result of the migration of previous PFAS connected with the paper sludge placed on that field located directly to the south of the Hazelwood.
Okay, and another question for Eagle. Why can't we have Otsego city water tested further? Many health surveys report being on city water.
I'll be happy to take that one. It's Dave Haywood with the Eagle again. In fact, not only Otsego city water, but Otsego, we also have the township of Otsego and then the city of Plainwell are the three municipal water systems in the study area. And the municipal water systems are regulated under the Safe Drinking Water Act here in the state of Michigan, which is overseen by our colleagues in what's called the Environmental Health and Drinking Water Division. And they are required to monitor the water that they are distributing through their system on a regular basis for multiple contaminants. And if you go to the websites of each of those municipalities or government entities, you should be able to find a link to the results of their water testing. If you have trouble finding it, just give them a call and they'll generally help you find that or send out a report. They're also required to report annually to all of the folks on their that are connected to their systems, the results of the water testing.
All right, thanks, Dave. Back to Eagle. Will the state be conducting additional testing of previously untested wells located near the sludge application or landfill sites?
Yes, so that was one of our last next steps, is to continue to identify other fields that we may have missed that or didn't sample that received paper sludge historically. So the intent is to continue to identify some of these fields and then continually identify which wells would potentially be receiving the groundwater, or rather with the groundwater leaching through some of those soils and down to groundwater into those wells. So yes, so that's a yes to that question. And then the second question, if you can repeat that for me, I've lost it on the chat here.
I don't think there was a second part of that question, Chris.
Okay.
All right, so let's go to the next question. Plant uptake of PFAS is a major concern. Concentrating PFAS in plants to levels potentially greater than in soil or groundwater. Has there been, or will there be, any sampling of plants grown in the fields where PFAS sludge was applied?
This is Dave. I can take that one again. There has not been any sampling of plants grown in the fields in the Otsego area study to date. There is testing of plant materials at other sites in the state that are going on right now. The Michigan Department of Agriculture and Rural Development, which is one of the many agencies that are that make up the MPART, Michigan Public Action Response Team group. And so I know that research is occurring in this area, and so stay tuned.
Okay, next question is from O'Day. For the residents who rely on private water wells, will they receive any financial assistance moving forward to continue to monitor PFAS levels in their well?
I can take that one from Eagle's perspective. So again, we conduct our investigation based on the information that we have, and as Chris has explained in quite a bit of detail, we've been investigating over the course of a couple of years to try to identify the wells that we think or to identify wells that may have a problem. We've identified a number of wells that did have problems, and they have been, as soon as we find a well that has levels exceeding the applicable criteria. Then the health departments, local and state, work together to provide that particular well owner with the point of use filter as an interim response action. And then, and as Chris, explained, we have continued to sample additional wells near the farm fields, and we will continue to do that as we identify other farm fields based on investigative work that's going on right now. As far as financial assistance, if, for instance, if you have a well that is in an area that's not necessarily next to a farm field, but you're concerned about it, you can certainly contact our office and we'll take a look at it. Otherwise, the Eagle Laboratory that is operated under the Remediation and Redevelopment Division does offer a kit for doing your own sampling, and it's approximately $300, and it's a complete package. They'll mail the kit to you. They'll provide all the the sampling bottles and sampling gloves and very specific instructions on how you are to take the sample, and then they'll provide you with material to mail the sample back to them. They'll analyze it and then report the results to you.
All right, we do have a couple. Did you have something to add, Chris?
Oh, sorry, I was going to answer the next question on MPART. If there's a question on, if that's the next question.
Yeah, and I see Lawrence has his hand raised as well.
Okay, so MPART is Michigan PFAS Action Response Team. It was created. It's a body that was created by a executive directive by the governor in 2017 to investigate sources and locations of PFAS to protect public water and public health for drinking water. So.
All right, and Lawrence also says that Eagle is one of his customers, and he hears that Michigan is contaminated with PFAS in New Jersey as well. Have we seen the PFAS map? And he's got a couple more questions here. Les, can we unmute Lawrence so he can ask us questions?
Well, I can respond to these questions.
Well, I'm not sure if Lawrence had additional questions. He's got his hand raised here.
Okay, can you hear me?
Maybe you can take care of all of your questions at once here, Lawrence.
Lawrence is unmuted.
Yeah, I can take care of it with one question. Approximately how many million gallons per day do these, you said there was 3 municipal treatment plants in this area. How many million gallons per day? I mean, it's probably a lot, right? It's a whole county?
Are you talking about the 3 systems in our study area, Lawrence?
I beg your pardon?
Are you talking about the 3 municipal systems in our study area here, the Otsego area study?
Yes, sir.
Yeah, we don't have those figures on how many millions of gallons a day that they're distributing. As far as any bids for municipal carbon filters or resins, that's not going to take place through the state. Each individual municipal system is responsible for any treatment that may be required. 2 years ago, all of the type 1 water supplies were sampled throughout the state, and there were very, very, very small percentage that came back with detections that were of concern.
And could I also add that Michigan has been very proactive in looking for PFAS, and we do have maps showing to date 151 PFAS sites in the state of Michigan, but we are proactively looking for them. And working them and documenting them. So you may hear that Michigan is contaminated. PFAS is everywhere. We're very busy looking for it. And then Les, can you also unmute Christina? She has a question here too she'd like to ask.
Can you hear me?
Yes, we can. Go ahead.
Thank you. I'm actually looking for some answers for Bill Farrell, if you don't mind. Where is Otsego at as far as getting an epidemiological study? What more has to be shown to make a study happen? And knowing that PFAS has not been specifically researched completely, what do we have to do to make things happen?
Well, as far as health studies, and I guess, first of all, I'll just focus on PFAS. I mentioned the 2 health studies that are being done in Michigan, the North Kent County area and the Parchment area. And in those particular areas, as I mentioned previously, there is a significant amount of exposure data. They've actually, a lot of drinking water samples were collected. So those studies are moving forward, and it's important to understand that those studies, I think I said before, those studies benefit not only the people who take part in them, but everybody else, because it provides more information to understand PFAS chemicals and specifically the relationship between the level of PFAS that individuals are exposed to and the health outcomes. So with respect to the Otsego area, there right now, the health study is just focusing on the North Kent County area and the Parchment Cooper Township area.
All right, let's move to our next question. And this is again, Christina. Statements have been made that the fields are being tested. Have roads where binder have been applied also been tested?
Yeah, I can take this. This is Chris Lanting again. They have indeed. We did, I believe it was 9 samples, and we tested them for both dioxins, furans, and PCB congeners or coplanar PCBs, and then as well as for PFAS as well. So those results, in fact, there are several maps depicting the results of the PFAS investigation of the road binder that are on the current area of interest, with a short description of that on the website currently.
All right. I'm going to jump ahead here a little bit to a question from Craig. We haven't heard from Craig yet, so I want to be sure he gets his question in, and then we're going to jump to Gretchen. And we'll get back to the other questions from our previous questioners in just a few minutes here. Craig has a question. Why hasn't there been more done to contain the landfill, knowing the landfill is the highest priority source for PFAS currently, and it's currently still leaching?
That's a good question. Thank you for that, Craig. So, initially we did some investigation, and of course it was limited in scope, but it was to just preliminarily identify what is compromised in there, if we could identify any PFAS with it, whether it be in the cap or the material within the landfill. And sure enough, we did indeed identify it. But certainly before a corrective action is proposed, it requires a remedial investigation to evaluate the extent of that and the conditions therein. So we certainly, I think at this point, have a real good understanding of the landfill conditions and concentrations of PFAS, and are looking at this point to proceed in that direction. Again, we don't have, as Dave Haywood indicated, we don't have a consent order through the state with Menasha to force them, or some agreement as of yet. So getting them to put a cap on it at this point, or in that perspective, or from that consideration, is not quite there yet. And so we're working with them to do that work so that the taxpayer does not do, we could go put one on there sooner than later, perhaps, but we're trying to work with Menasha to do that work. So stay tuned for that.
Okay, thanks, Chris.
Yep.
Next we have, well, it's a comment. I'm not sure what exactly what the question is here, but Mark Johnson, this is for you. I'd like to spend, I spent a lot of time as a child growing up right next to the pits, and I'd like to ask about the health concerns for those of us now that are having health complications.
Yeah, this is Mark Johnson. I'm the regional director for ATSDR, which is the environmental health part of the Center for Disease Control. So I've been involved with this since the beginning in supporting the county and state health department, as well as supporting Eagles sampling. So we know, and all what you've heard tonight is really a summary of what's been found recently in terms of the sampling of wells, of groundwater and soil. And what we do know from looking at the record is that the Menasha waste management system back in decades ago was not very responsible, I think, the way to characterize it, in terms of their application of the sludge in unlined pits, and also the waste black liquor in the emergency pits that resulted in contamination of groundwater and ultimately in contamination of private wells along 106th Street and Hill Road. So we know that that occurred historically in decades ago. We don't know how long it went on for, but likely for many years. We don't know exactly the composition of that contamination because the sampling that was done to when it was first identified in the wells that led to extension of water lines to those areas. That sampling was really done with not a lot of detail. So we don't really know the characteristics of the contamination in those wells, but it was likely to be pretty significant. And that's the concern, that we may never be able to know exactly what exposures people experienced in those areas, other than we know those were contaminated. So it's one of the things we're looking at closely to see if there's something we can glean from the records from Menasha, but also hearing about people's experiences and their health problems they've been having may help guide us to design an appropriate study to look at them more closely. But they really, the priority that we really focused on though is really characterizing current exposure in the community. That's why you're hearing so much about the well sampling, because we want to make sure that if those are found, we take appropriate action to mitigate that exposure and to prevent future health effects from that exposure. And so our view and evaluation of the past is complicated, but we are continuing to look at opportunities to look at them more closely.
Okay, thanks, Mark. I am going to a new questioner, and I promise we're going to get to all of these questions that we have. I realize we're at 8 o'clock, which was our ending time, but we'll stay on and answer these questions. So we have a question from Elizabeth. Why don't full records exist of farm locations that sludge was spread? So why don't full records exist of locations where sludge was spread, I think is the question.
So the information that we have, and I know one of the comments says that there's a full record of all of that, and we've gone through it and have identified fields outside of what's in the data provided by Menasha, and that was part of the Superfund discussions to determine if Menasha at one point was going to be one of the potential responsible parties as part of the Superfund site. So that's how the Department of Justice gets records from them. They request those records. So we have that in our file, and it does not, for us, we've determined that it's not a full record, and it doesn't, when they put some of the paper sludge on a field, we don't know exactly where they put it on that field either. So some of the results of our soil sampling on some of the fields indicates, hey, we found it primarily near the road where they put the paper sludge, but further back on the same field, they didn't travel back there. It's non-detect for PFAS. So it's not, the records don't demonstrate exactly where they put it on every certain year either. So that's part of the reason why we're asking certain individuals to help us identify other fields as well that may not be in those files received from Menasha as part of the legal work previously done.
Thanks. A question from Lisa. Could the crops planted in the fields be contaminated with PFAS?
You know, that's a good question. There's some discussion about when you put various insecticides and herbicides on various different fields. They call it a wetting agent to help hold those insecticides to the plants for a longer period of time to be more beneficial for preventing either fungus or insects from impacting those plants for a longer period of time. So sometimes, and some studies do show some wetting agents did include some types of PFAS historically. Do we have any information regarding that? Currently, we don't. And I think Dave Haywood touched upon that briefly about our involvement with MDARD and ongoing studies elsewhere. So that's that's not really clearly understood either at this point.
Okay. A question from Craig. Is it safe to eat deer around the landfill location?
I'll take that one. Craig, we can't answer that question right now because we haven't sampled any of the deer, and we need to work with our colleagues in the Department of Natural Resources, and we've been put in touch with individuals that they harvest deer in areas where PFAS contamination is known to exist, and so we need to get that done as soon as possible.
Okay. Bill, a question for you. You talked about parchment in northern Kent County. Did you mean northern Kalamazoo County? Yeah, you're talking about the health studies.
Yeah, North Kent County and the Parchment area. Those were the two areas.
Yes. Okay. I'm gonna go back here. Question from Connie. Is the poor quality of the cap responsible for the perched water in the landfill?
That's a very good question. I didn't show the figure on this presentation, but we did in the last year's presentation, we did a total of 8 hand auger borings. So we evaluate the thickness of the cap, not for the purpose of looking at concentrations, but just simply how thick it is. And we did identify numerous areas where the cap was either absent or extremely way less than the intentional design of prescribed in the design documents. So we certainly believe that is likely a possibility that it's leaching through the cap in some of the areas and contributing to the PFAS, or rather elevated PFAS in the perched groundwater within the landfill.
Okay, thanks, Chris.
Yes.
I have a note here that I'm seeing Christina posing questions, and this is actually Mary Zach. So thank you for that clarification, Mary. And I'm going to get to one of those questions that you had. Is there any discussion about possible past exposures when Menasha contaminated the city wells in the late 70s and injected biocide into the wells?
Mark mentioned that in his response, but I will say that that is something that we are looking at in public health assessment. So unfortunately, as Mark said, unfortunately, there's limited information with respect to what people may have been exposed to and the degree they may have been exposed. But it is something that we are going to look at and address in the public health assessment.
Okay. A question from O'Day. Did you notice any difference in filtration or mobility between PFOS and PFOA in this area? Does one tend to absorb to soils better than the other?
That's a very good question. Interestingly, specifically to the Hazelwood investigation, which we briefly touched on in the earlier, what we see as the contaminant within the wells at Hazelwood is primarily, certainly much higher, is the PFOA contaminant, and to much lesser degree the PFOS. And when we look back at the soil concentrations as well, we see actually PFOS that was detected in the soil samples that we collected, but not the PFOA. So it may suggest, and I'm not saying that it does for sure, but it suggests that perhaps the PFOA is much more mobile and was leached out of the soils that resided in that field down into the groundwater and then mobilized down towards the wells at Hazelwood, wherein the PFOS was less mobile, and consequently there's still some residual in the fields, the farm fields, and all of it hasn't been completely leached and or migrated downward to the groundwater table and then mobilized northward towards the Hazelwood wells. If that makes sense.
Okay. A question from Mary. Are there any discussions regarding the old Rock 10 58 acres that currently has a 120-page environmental assessment? Eagle, it seems that's a question for you.
We are aware that it was recently purchased, and as part of that purchase agreement, they did a phase 1 and then a limited phase 2 investigation to identify existing contamination there. I have not gone through it fully. I don't believe any of my colleagues have at this point. I know we did sample a well or two there. I think we presented that in one of our earlier presentations in 2018, October, some of the groundwater results, but we have not done an extensive study on that particular property.
Okay. A question for Mary, and we may have answered this one, but let me pose it again. Will there or will there not be a human health study? What would warrant one? How many detects?
Yeah, I'll answer. Sue, I think to answer that, I'd like to go to one of my slides.
Okay.
And it's the third slide, I believe. It's our public health process. Okay. The next one after. Nope. Yep, back one. Back one more. Yep, right here. Is there a public health concern? I talked about our process, and the things I talked about was characterize, quantify exposures. And I mentioned that that's basically the most important component, the most important piece of information that we as public health use to in the work that we do. And that's whether we're doing a simple investigation, whether we're doing a public health assessment, whether we're doing, even if we're doing an epidemiological study or a health study, trying to characterize and quantify that exposure. Because basically, as I mentioned, one of the most important pieces of information that we try and gather from a health study is the relationship between the degree, the level of exposure of a hazardous substance and the health outcomes. So with respect to the Otsego site, we have limited data, and the data that we do have focuses on PFAS. And as I mentioned, we are doing health studies that are looking at PFAS exposure. So using the limited information that we have, basically without having that exposure component, a health study, it would be really wouldn't provide a significant amount of information to draw conclusions. So at this point, based on what we have, we do not have plans to do a health study.
Okay. Another question from Mary. there is, or a comment, I suppose, there is a full list of all farms applied in the EPA archives, names of farms, years applied, and tonnage dumped. Eagle, can you respond to that?
Yes, I certainly can. And we do have that. That's somewhat of what I was describing in the 104E. That's the document that is provided to the EPA at the request of the Department of Justice during the negotiations to determine who is a Superfund contributor, downgrading of the PCBs. And so we did indeed see that information, and it's not entirely comprehensive of all the tonnages and all the locations. So, but we did look at that. We certainly did. Yep. And that's what we used primarily in developing much of the areas that we screened. And so let me revisit that as well. When we initially did the soil study, the study wasn't intended to evaluate and sample every single field. It was to get a good sampling, to get a sense for, hey, what is the result? We didn't know at that point in time, of course, that there was PFAS on any field for that matter. So the intent is to do a study or screen as much as we can, a very sizable data set, which we did indeed. In fact, I believe we took 6,000 or about 6,900 cores for that activity. So we did a fairly exhaustive effort to make a real good effort to understand where we have and where we don't have for some of the majority of the fields that we identified. We didn't do all of them, certainly not, and there's still some work to do for further consideration of wells nearby those fields. But we certainly have an understanding of what the results are in many of those areas. That answers it.
Okay. We just have a question from Lawrence. How many residents are in the study area?
I think in the study area, it's approximately, Dave Haywood, I think you recall, I think we talked about 800 plus or minus residents in the area. So just as an FYI, yeah.
Chris, do you mean residents?
Residents on private wells.
Correct, yes, thank you for clarifying. On private wells, correct.
Okay. That was the last of our questions. So let me take just a moment, if you don't mind, and we really appreciate you staying on with us here. I'll make this quick. I just want to show you the MPART website and a couple of key places you might want to look. Across the top of the web page, you'll see different topic areas, and if you click on those, you'll find health information, information on drinking water, investigations, etc. Back on the main page, you'll find topics of particular interest at the moment. So Eagle does monitor the traffic that the website gets, and they'll post buttons to the topics that are getting the most attention at the time. You'll also see frequently asked questions here. If you want to sign up to receive weekly updates, you can do that. And then learning more about MPART here. I did want to show you the investigations page. So if you click here, you'll see areas of interest. And at the moment, the Otsego study area is here. And as Chris mentioned, that will be moving to become a site. So then once that moves, you'll find PFAS sites here under this button. And if you scroll down, you'll see a map of all of the sites. You can export the data set. You can see the new sites. And then you'll see all of the sites listed here. I want to point out that if you click here on these titles, it will sort those for you. So you can sort the site names alphabetically and the locations alphabetically. So it's a little bit easier way to search through the page if you're looking for a particular site, and in particular the Otsego page. And as I mentioned, it's here at the moment. This is where you will find the recording of this meeting, and you will also find the slides from this meeting. There are also maps on this page. So that's another location to look for maps, in addition to the PowerPoints that'll be posted. So I just want to take a minute to walk through that so you can understand how to use the page. And the website address is michigan.gov/PFAS response. All right. Here is contact information for the agency staff that presented today, and also some additional staff. Kalamazoo County Health Department is also involved at this site, since there are some residences that fall within Kalamazoo County. And here's Chris's contact information, Angelique's, and Bill's, and Rosa and Lisa are also toxicologists working on this site. So I'm gonna just give you a thank you. We really appreciate you staying with us so late today. We appreciate all of your questions and comments. Keep them coming, please. And you know where to find the agency staff that can answer further questions for you. Thank you to everyone. Be safe, be well, and take care.
Thank you, Sue.
Good night.
Good night. Thank you.